Welcome back, everybody. Before we get started, if you're enjoying the show, please take a second to like and subscribe. It really helps others find it. And today we're examining the VA Community Care Program,
Yeah,
a program that's supposed to help veterans get the health care they deserve.
right.
We're looking at the big picture, the good, the bad, and everything in between.
And we have a really diverse set of sources for this one.
Yeah,
We've got firsthand accounts from veterans and their spouses,
yeah.
as well as reports from veteran service organizations and
Okay.
some real experts in the field.
So a mix of personal stories and policy analysis.
Yes.
Let's start with the basics. What exactly is the VA Community Care Program?
So the VA Community Care Program is designed to give veterans access to health care in their community
Okay.
when the VA can't provide it.
Okay.
So maybe the wait times are too long or the specialized care they need isn't available at their local VA facility.
So it's about filling those gaps in care
Yeah.
and making sure veterans have options.
Right. And it's actually been expanded in recent years,
Oh, okay.
and particularly through the Mission Act,
Mm-hmm.
which was passed with the goal of increasing veterans' access to care.
Okay, so we have this program in place,
Yeah.
and it's supposed to be helping veterans access care.
Yeah.
What's the reality, though? What are we seeing in terms of successes?
One of the biggest successes, honestly, is that it's opened up access to care for veterans, especially those in rural areas
Okay.
who might live far from a VA facility.
Yeah, and that makes sense.
And the program is actually growing in popularity,
Okay.
with more veterans choosing to use community providers.
So convenience and choice are big factors here.
Absolutely. And sometimes it even comes down to a lack of trust in the VA system. Some veterans feel more comfortable seeking care outside of the VA.
Yeah, I can understand that. It's about finding a healthcare environment where they feel safe and heard.
Absolutely.
But it also sounds like there's a lot of potential for strong partnerships between the VA and community providers.
Absolutely. When the VA and community providers work together effectively,
Mm-hmm.
it creates a network of care that benefits everyone.
And let's not forget the role of telehealth.
Oh, yeah.
It's been a game changer,
Absolutely.
especially for veterans in rural areas who might have difficulty traveling to appointments.
Telehealth has really expanded the reach of healthcare,
Yeah.
making it more accessible to those who might otherwise face significant barriers.
So far, it seems like the program is doing what it's set out to do,
Yeah.
increasing access and providing options.
Mm-hmm.
But I'm guessing there are also challenges.
Unfortunately, yes. And these challenges are preventing the program from reaching its full potential.
Let's talk about those challenges. What are some of the roadblocks that veterans are encountering when they try to access care through this program?
One of the most common issues, honestly, is simply a lack of awareness.
Oh,
Many veterans don't even know that the community care program exists
right.
or what the eligibility requirements are.
So even before they can access care, they're hitting a wall of information.
Exactly. And even if they know about the program
Yeah.
and are eligible, there are often administrative burden that can delay care.
Okay.
The referral and approval process can be complex and time-consuming.
So even when a veteran is eligible, they still have to navigate a bureaucratic maze.
Yeah.
What else?
Another big challenge is coordination.
Okay.
The VA and community providers don't always communicate effectively, and there can be issues with sharing medical records.
Okay.
This can lead to delays,
Yeah.
gaps in care,
Right.
and even safety concerns.
It sounds like a lack of seamless integration between the two systems.
Right. And this lack of integration can be incredibly frustrating for veterans who are trying to access the care they need.
We've talked about awareness,
Yeah.
administrative burdens,
Yeah.
and coordination issues. Are there any other major challenges that stand out?
One issue that comes up repeatedly is the lack of consistent implementation.
Okay.
The program is implemented differently across different VA facilities,
Mm.
which means a veteran's experience can vary widely depending on where they live.
So a program that's designed to provide equal access to care ends up creating unequal experiences.
It's a significant problem that highlights the need for more standardized procedures and oversight.
Okay, so we're starting to see a pattern here.
Yeah,
These challenges are affecting access to care across the board,
right.
but I'm wondering if there are specific challenges that veterans face when it comes to mental health
Yes,
and substance abuse care.
absolutely. This is an area where the challenges are particularly acute.
Okay.
One of the biggest issues is the lack of access to timely residential rehabilitation treatment programs for mental health and substance use disorders.
Okay.
These programs, which are often crucial for veterans struggling with these issues,
Yeah.
aren't subject to the same access standards as other types of care under the Mission Act.
So even though the Mission Act was supposed to expand access,
Right.
it doesn't fully address the needs of veterans seeking this type of intensive treatment.
Unfortunately, that's the case. And on top of that, there's the issue of referrals.
Okay.
Veterans often need a referral from the VA
Mm-hmm.
to access mental health and substance abuse care in the community.
Yeah.
And this can create delays,
Yeah.
especially when a veteran is in crisis and needs immediate help.
So in a situation where every minute counts,
Right.
a veteran might be stuck waiting for a referral.
It's a heartbreaking reality.
Yeah.
And then there's the issue of provider choice.
Okay.
Sometimes veterans aren't allowed to choose a specific type of mental health care,
Okay.
like individual counseling,
Mm-hmm.
if the VA believes it can offer something comparable.
But what if the veteran has specific preferences or needs that aren't met by the VA's offerings?
That's a valid concern, and it speaks to the larger issue of empowering veterans to make decisions about their own health care.
So we're seeing these layers of barriers,
Yeah.
access to residential treatment delays due to referrals, and limitations on provider choice. Is there anything else that's preventing veterans from getting the mental health care they need through this program?
Another significant issue is the adequacy of training for community providers.
Okay.
Not all community providers have sufficient training in military culture,
Right.
suicide prevention,
Yeah.
and trauma-informed care practices, which are essential for effectively treating veterans.
So even if a veteran can access a community provider,
Right.
that provider might not have the specialized knowledge and skills to address their unique needs.
That's exactly right. Veterans often have complex needs stemming from their military service.
Yeah.
And it's crucial that their healthcare providers understand those needs and
Right.
how to address them.
We've been talking about these challenges in a somewhat abstract way,
Right.
but I think it's important to bring this conversation down to a human level.
Absolutely. To really grasp the impact of these challenges,
Yeah.
we need to hear from the veterans themselves.
Let's do that. Let's shift gears and delve into some of the personal stories shared by veterans and their families about their experiences with the VA Community Care Program.
I think you'll find these stories both illuminating and heartbreaking.
Yeah.
They'll shed light on the human cost of these systemic challenges.
Let's start with the story of Eric Gulnick,
Okay.
a Navy veteran who experienced a year-long wait for therapy after seeking mental health care through the VA.
A year is an incredibly long time to wait for care,
Yeah.
especially when you're dealing with a mental health condition.
It's unimaginable. And this experience was so impactful for Eric that it inspired him to co-found a company to help veterans access mental health services. He saw a need and took action.
Yeah, it speaks to his dedication to his fellow veterans and
Yeah.
his determination to make a difference.
What about other veterans? Are there similar stories of long waits and bureaucratic roadblocks?
Unfortunately, yes. There's the story of Paige Marg and
Yeah.
her husband Charlie, an Air Force veteran, who faced numerous challenges while trying to access mental health care through the community care program.
Paige's testimony before the Senate Committee on Veterans Affairs was incredibly powerful. Let's hear more about her and Charlie's story. What were some of the specific challenges they encountered?
So Charlie, despite having a 70% mental health rating from the VA and being medically retired,
Okay.
struggled for years to get consistent mental health support.
Oh, wow.
Paige describes a constant cycle of referrals,
Mhm.
delays,
Yeah.
and a frustrating lack of continuity of care.
It sounds like the system was failing them at every turn.
It's a truly heartbreaking story, and I think it will resonate with many veterans and their families who
Yeah.
have faced similar challenges. It's clear that the community care program,
Mhm.
while well-intentioned, isn't always working as it should.
And it's leaving some veterans feeling abandoned and hopeless. But we don't want to end on a note of despair.
Right.
There are solutions out there.
Yeah.
Let's talk about what can be done to improve the VA community care program and make sure veterans are getting the timely and effective care they deserve.
There are many recommendations for improvement, and I
So-
think they offer a real path forward.
Let's hear those recommendations. What needs to change?
One key recommendation is to codify access standards.
Okay.
This means writing specific access standards into law.
Mm-hmm.
So veterans have a legal right to choose community care,
Yeah.
when the VA can't meet those standards.
So it's about making those standards more concrete and less subject to interpretation
Exactly.
or variation between different VA facilities.
Another crucial recommendation is to streamline the referral and approval processes,
Okay.
which are often cited as a major source of delay and frustration.
Less bureaucracy, more action.
Right. And then there's the issue of record sharing.
Mm.
We need to find a way to improve the transfer of health records between the VA and community providers
Okay.
to ensure a smoother and more coordinated approach to care.
It's about modernizing the system and making it work for veterans, not against them.
Absolutely. And let's not forget about the importance of training.
Oh.
Many sources recommend expanding training for community providers on military culture,
Yeah.
suicide prevention,
Right.
and trauma-informed care practices.
Equipping community providers with the knowledge and skills they need to effectively serve veterans.
Exactly. And when it comes to mental health care, there are a few more specific recommendations worth highlighting.
Let's dive into those. What can be done to improve access to mental health care through the community care program?
One suggestion is to eliminate referrals for veterans seeking mental health care.
Okay.
This would remove a significant barrier to care,
Yeah.
especially for those in crisis.
I can see how that would make a huge difference. It would allow veterans to access care when they need it most
Yeah.
without having to wait for a referral. What else?
Another recommendation is to create VA certification requirements for private facilities that
Oh.
participate in the Mental Health Residential Rehabilitation Treatment Program. This would ensure that community-based residential treatment facilities meet certain quality standards
Right.
and are equipped to provide effective care to veterans.
So it's about setting a bar for quality and accountability within the community care network.
Yeah.
What other recommendations are out there?
Another suggestion is to require mental health outcome measures for veterans receiving care through the program.
Okay.
This would help to track progress,
Mm-hmm.
ensure accountability,
Yeah.
and identify areas where improvements are needed.
It's about making sure that care being provided is actually making a difference in veterans' lives.
Exactly. And we also need to address the geographic disparities in access to mental health and substance use disorder treatment.
Okay.
Rural veterans, in particular, often face limited options.
Ensuring that every veteran, regardless of where they live, has access to quality mental health care is essential.
Absolutely. And one final but crucial recommendation is to empower veterans to make their own decisions about their health care.
Give them more control,
Right.
more choice, more agency.
Right. Let them decide what kind of care they want, where they want to receive it,
Yeah.
who they want to provide it.
It's about respecting veterans' autonomy and recognizing that they are the best advocates for their own health and well-being.
Exactly.
It seems like a theme is emerging here, giving veterans more control,
Yeah.
more options,
Right.
and more of a voice in their health care.
Absolutely. One suggestion is to allow veterans with service-connected disabilities the option of using TRICARE Select,
Okay.
which many veterans are already familiar with,
Right.
instead of VA care.
So expanding their options to include programs they might already be comfortable with.
Right. And alongside expanding choices, it's about making the existing processes work better. For example, simplifying and automating the referral and approval processes.
Cutting down on the bureaucracy to
Yeah.
get veterans the care they need faster.
Exactly. And we can't forget about the transfer of medical records. A seamless transfer of information between the VA and community providers is essential.
That way veterans don't have to repeat their medical history every time they see a new doctor,
Right.
and there's less room for errors.
Precisely. It's about creating a smoother, more integrated system of care.
Yeah.
And it's also about making sure veterans are aware of their options.
Okay.
Many veterans still aren't familiar with the Mission Act
Mm-hmm.
and what it offers.
So educating veterans about their choices is key.
Yes, knowledge is power, especially when it comes to healthcare.
Yeah.
We need to make sure veterans are equipped with the information they need to advocate for themselves.
This has been really eye-opening. We've uncovered a lot of complexities within the VA community care program,
Yep.
both positive and negative. But now I want to hear from the people working directly with veterans every day,
Okay.
the veteran service organizations.
Yeah, their insights are invaluable.
Yeah.
They see the program's impact firsthand.
Let's start with the Disabled American Veterans, or DAV.
Okay.
What's their perspective?
The DAV strongly supported the Mission Act, but emphasized the importance of keeping the VA as the primary coordinator of care.
Okay.
They want to ensure that community providers meet the same standards as VA clinicians.
So it's about supplementing the VA with quality community care, not replacing it.
Exactly.
Yeah.
The DAV highlighted concerns about the coordination of care and timely transfer of medical records, which we've already touched on.
So it seems like the need for a more integrated and efficient system is a common thread.
It is.
Yeah.
And the DAV also stressed the importance of training for community providers,
Okay.
especially when it comes to mental health care
Right.
and suicide prevention.
Mm-hmm.
They recommend training in military culture, suicide prevention.
Okay.
And lethal means safety counseling for providers who treat veterans.
That makes sense. We need to make sure those community providers are equipped to understand and support veterans' unique needs.
Absolutely. The DAV also brought up the unique challenges faced by women veterans,
Mhm.
especially when it comes to care coordination for things like maternity care,
Okay.
which are often provided in the community.
The needs of women veterans are often overlooked, so it's great that the DAV is bringing attention to those specific challenges.
Now, another organization doing important work is America's Warrior Partnership, or AWP.
Yeah.
They take a one-size-fits-one approach to helping veterans by connecting them with local resources.
That's a great approach.
Yeah.
It recognizes that every veteran is an individual.
Exactly. AWP believes veterans should have choices in their health care,
Hmm.
whether that's the VA or community providers.
Yeah.
They see community care as a way to bring veterans back into the healthcare system,
Right.
especially those who may not trust the VA.
If a veteran is more comfortable seeking care outside of the VA, we should support that choice.
AWP echoed the concerns about awareness administrative processes and
Yeah.
coordination of care that we've discussed.
So these are consistent themes across multiple organizations.
They are. AWP also recommends codifying access standards,
Mhm.
eliminating referrals for mental health and substance abuse care,
Okay.
and educating veterans about their options, all of which we've talked about as well.
So a lot of overlap in terms of the challenges and the proposed solutions. Now, what about the Wounded Warrior Project?
Okay.
They're another prominent organization focused on supporting veterans.
The Wounded Warrior Project, or WWP, primarily focuses on supporting post-9/11 veterans and has been vocal about mental health care for this population.
Mental health is a huge concern for post-9/11 veterans, so their expertise in this area is really important.
One of their concerns is access to residential rehabilitation treatment programs,
Yeah.
which, as we discussed earlier, aren't subject to the same access standards as other types of care.
That means longer wait times and more barriers for veterans who need this intensive level of care.
Right. WWP also points out inconsistencies in how different VA facilities handle community care referrals.
Okay.
Some are more supportive of community care than others,
Right,
which
yeah.
can be confusing for veterans.
So a veteran's experience might depend on their location or even the individual staff they interact with?
Unfortunately, that's true. And WWP also brought up concerns about the timeliness of care,
Mm-hmm.
the effectiveness of training for community providers,
Okay.
and the seamless transfer of medical records.
Right.
All issues we've discussed.
It sounds like these challenges are systemic, not just isolated incidents.
Exactly. It's important to note that WWP, like AAWP,
Mm-hmm.
is using its resources to help fill in the gaps and provide veterans with care when the VA system can't.
It's commendable that they're stepping up,
Yeah,
but it also highlights the shortcomings of the existing system.
I agree. And to round out our exploration of these different perspectives, let's revisit the testimony of Paige Mark, the veteran spouse we discussed earlier.
Her story was particularly moving. It really brought home the human cost of these systemic issues.
Paige's testimony underscores the need for improved mental health care access,
Right.
especially for veterans in crisis. She spoke about the long wait times,
Yeah.
lack of continuity of care,
Mhm.
and bureaucratic hurdles that she and her husband faced.
Her story is a call to action. We can't let veterans and their families down like this.
We need to listen to these stories and make sure the system is truly serving veterans.
So after hearing all these perspectives,
Yeah.
the successes, the challenges, the recommendations,
Mm.
what are the key takeaways?
Okay.
What needs to change to make the VA community care program work better for veterans?
There are a few crucial elements that need to be addressed.
Oh,
First, clarity and transparency are paramount.
okay.
Veterans need to understand the program,
Mm-hmm.
the eligibility requirements,
Right.
and their options.
No more confusion or misinformation.
Exactly. We also need to streamline the administrative processes that cause delays and frustration.
Make it easier for veterans to get the care they need.
And of course, we need better coordination between the VA and community providers, which
Right.
includes seamless record sharing and a unified approach to treatment.
No more veterans falling through the cracks between two systems.
Right. And we can't forget about the importance of expanding training for community providers on military culture, suicide prevention, and trauma-informed care.
Equipping those providers with the tools they need to effectively serve veterans.
And finally, we need to empower veterans by giving them more control over their healthcare choices, including their preference for community care.
Put veterans at the center of their own care.
Exactly. These are the essential steps toward creating a VA community care program that truly works for the people it's meant to serve.
So after hearing all of that,
Yeah.
what strikes you as the most important factor in improving the VA community care program?
I think the thing that keeps coming up is trust.
Okay.
So many sources,
Yeah.
from veterans themselves to the organizations that support them, emphasize how crucial it is to rebuild trust in the VA healthcare system.
If veterans don't trust the system,
Yeah.
they're not going to use it,
Right.
which can have a huge impact on their health and well-being.
And when we look at what erodes that trust,
Yeah.
It's often inconsistent access to care, bureaucratic obstacles,
All right.
and a sense that the system doesn't understand veterans' unique needs.
So for the VA to rebuild trust, it needs to show veterans that their needs are a priority,
Right.
both within the VA and through community partnerships.
It's about changing the way we think about community care.
Okay.
Instead of seeing it as a threat to the VA, it should be seen as a valuable tool for improving care and access.
Community care should be an extension of the VA's commitment to veterans, not competition.
Right. Recognizing that the best care might not always be inside a VA facility, and being open to partnerships with community providers is key.
Ultimately, it's about putting veterans' needs first
Yeah.
and being willing to adapt to meet those needs.
That's the big takeaway. The VA community care program has the potential to be a real force for good in veteran healthcare,
Yeah.
but it needs collaboration, innovation,
Right.
and a true understanding of what veterans deserve.
It's not just about tweaking a program.
Right. It's about a larger cultural shift within the VA.
You've hit the nail on the head.
This has been an incredibly insightful look at the VA community care program. We've gone from its origins and goals to the experiences of veterans trying to navigate the system.
Yeah. We've examined the successes, the challenges, and the recommendations for change.
Now, as we wrap up, here's a question for our listeners. Based on everything we've discussed, what do you think the future holds for the VA community care program? Will it evolve to meet the needs of our veterans, or will it stay stuck in the same bureaucratic struggles?
It's a critical question, and one we'll continue to grapple with as the program develops.
If you want to learn more, check out the show notes for links to the source materials and organizations we've mentioned. We've also included additional resources you might find helpful. And if you have any thoughts or questions, please leave a comment. We appreciate hearing from you. Thanks for joining us, and we'll see you next time.